Hello everyone. Welcome to our third session of webinar Resurgence of Nursing during COVID-19 pandemic. I am Anandakrishnan, Assistant Professor, Department of Medical Surgical Nursing. Before beginning with, I would like to thank our respected principal, Professor S. Narasimha Prasad sir, for giving me an opportunity to speak on COVID-19. You know that novel coronavirus pandemic is the defining global health crisis of recent time and is the greatest challenge we have been facing since many months. It is affecting not only the community health field but also the different strands of day-to-day lives. Even if people are not directly losing their jobs, lockdown are causing a devastating ripple effect. Production around the world is endangered. The coronavirus caused a break in the biggest link in the vast supply chain. As health professionals, we have the great role in tackling the dreadful disease, both in prevention as well as the management of COVID. In my presentation, I'll be focusing on the signs and symptoms of COVID-19. I am sure that you have already watched the previous webinars conducted by our Principal Sir and Akanksha Madam. So, you will have an idea about the disease and epidemiology as well. Let us start our session on signs and symptoms of COVID-19. Before moving to it, signs and symptoms directly, let's have a glance at the occurrence and some of the facts regarding coronavirus. COVID-19 or novel coronavirus. It is a new strain of beta coronavirus with approximately 70% genetic similarity to SARS coronavirus. The outbreak was first identified in Wuhan province, China, in December 2019. The 2019 novel coronavirus is getting a lot of attention now because it is a new kind of coronavirus we haven't seen among humans before. Coronavirus are a large family of single-stranded RNA virus, which are zoonotic in nature. These are known to cause respiratory infections, ranging from the common cold to more severe disease such as Middle East Respiratory Syndrome, that is MERS, and severe acute respiratory syndrome such as SARS. The World Health Organization declared the outbreak a public health emergency of international concern on 30 January and a pandemic on 11th of March 2020. The incidence of COVID-19 we can see in a nutshell. As of May 2020, more than 4.37 million cases of COVID-19 have been reported in over 188 countries and territories, resulting in more than 29 lakhs 7,000 deaths. More than 1.556 million people have been recovered. Currently, 81,990 cases were reported in India, which includes 2,649 deaths. The incubation period we believe to be 2 to 14 days. What we seen in our evidence now that older individual adults, especially men greater than 40 to 50 years of age with pre-existing comorbidities have more risk factors for contracting this virus, having worse clinical presentation or severe illness. In the most severe cases, most of them seem to have underlying illness such as lung diseases, heart diseases, and cancer. Cigarette smoking also a triggering factor of to get worsen the symptoms. Patients' clinical manifestations were first reported included fever, non-productive cough, dyspnea, myalgia, fatigue, normal or decreased leukocyte count, and radiographic evidence of pneumonia. Organ dysfunctions due to shock, acute respiratory distress syndrome, acute cardiac injury, and acute kidney injury, and death can occur in severe cases. Portal of entry of this virus through nose and mouth. Virus enters through the nose and mouth. Then it finds a host cell in the respiratory system. The host cell then bursts and infects the other cells nearby. The virus is transmitted between humans in droplets from coughing and sneezing, and even touching or shaking hands. Symptoms include dry cough, high fever, and shortness of breath. Most victims of the virus die from complications include pneumonia and fibrosis in the lungs. Signs and symptoms of COVID-19. Let us discuss. Basic symptoms are known. The World Health Organization states that the incubation period up to 14 days, but sometimes it could be longer, even up to 24 days. But typically symptoms shows in about 5 days. The current World Health Organization figure shows that 81% develop mild symptoms and 14% develop severe symptoms and 5% become critically ill. WHO says around 88% of people recover without medical treatment, but some people become affected and don't develop any symptoms. It starts with fever followed by a dry cough. In later, shortness of breath, and some patients require hospital treatment. Other symptoms are headache, tiredness, nasal congestion, sore throat, diarrhea, muscle aches, loss of taste or smell. In some cases, we could see discoloration of fingers or toes. Symptoms often shows mild and become gradually. If you are at high risk group with existing medical condition or elderly or with serious symptoms such as chest pain, difficulty in breathing, you should seek medical attention. According to some studies in China, the beginning symptoms are similar to common cold with mild sore throat, neither having fever or with fever. Sometimes the severe symptoms like fever can be more than 100.4 degree Fahrenheit or higher, and pneumonia, kidney failure, and the common symptoms like fever, mild breathing difficulties at the onset, and there will be gastrointestinal issues, diarrhea, general body aches. The symptoms are similar of MERS, that is Middle East Respiratory Symptoms, and severe acute respiratory syndrome SARS. The transmission of this virus can be through cough or sneeze from the infected person or touching the contaminated objects. The key symptoms of coronavirus mainly we can notice in many patients that are high temperature, cough, and breathing difficulties. These were observed in many countries. The common signs and symptoms of these infections are breathing difficulties, diarrhea, shortness of breath. In severe cases, we can see pneumonia, severe acute respiratory symptoms. This can lead to death. There is no particular treatment. No vaccines or antiviral drugs are available for this COVID-19 virus. Symptoms can be treated or symptomatic treatment can be given. It is said that hydroxychloroquine is an effective drug for some patients. Antiviral drugs such as lopinavir has been administered for some patients and they are getting recovery faster. To prevent the spread of coronavirus or COVID-19, what are the measures to be taken? Clean your hands often. Use soap or water or an alcohol-based hand rub. Maintain a safe distance from anyone who is coughing or sneezing. Don't touch your eyes, nose, or mouth. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, cough, and difficulty in breathing, you can seek medical attention as soon as early as possible. Follow the direction. It is better to follow the direction of your local health authorities. You can reduce the risk of corona infection by clean hands with soap and water. If it is not available, we can use alcohol-based hand rubs. Cover the nose and mouth when coughing and sneezing with tissues or with flex elbows. Avoid close contact with anyone with flu or cold-like symptoms. Thoroughly cook the meat and eggs. No unprotected contacts with live, wild, or farm animals. This is very important. You can protect yourself from the coronavirus because as there is no vaccines are available till now, we could wear a mask, wash the hands frequently, avoid contact with sick people, use SMS. S means sanitizer, M means mask, S means social distancing. As we know that we are healthcare workers who are providing nursing care and support to the patients. So let us salute to our healthcare workers who are risking their own lives against the COVID-19, the pandemic. So thank you all.